If you are using growth factors for repair, do it safely. Here are the rules that matter. Topical growth factor products in cosmetic use are generally well tolerated. Irritation is usually low, data is short to medium term, so we really want to use sensible caution for high-risk viewers, right? We just don't have the long-term study data like we do with some of the other products. So what does that mean in terms of practical use? Number one, you want to use it only on healthy skin. Avoid infections, active rashes, or any suspicious lesions. If you have a history of skin cancer, or you are under oncology care, please speak with your dermatologist before you pick up any growth factor at all. You also want to patch test inside the forearm for 24 to 48 hours before ever putting it on your face. If you are pregnant or breastfeeding, you discuss new actives with your clinician before you take it on. Just standard, practical, sensible advice. So what about using them and pairing them? Well, we know growth factors are proteins and they're very fragile. They're fragile, in terms of sensitivity to temperature, to heat, to pH level, and as well as exposure to air. You want to keep them away from strong, low pH acids in the same steps, whether that's your AHA, BHAs, or whether that's your vitamin Cs. If you're going to use those acids in the same routine, then you either put the acids on first and you wait maybe 5-10 minutes before you apply your growth factors, ideally put in something else, or you alternate days altogether where you're using those products on one day and growth factors on another day, or you do AM/PM use. If you're using it at night, then retinoids can be used in the same routine. There's nothing that contraindicates growth factor use with retinoid use. I've seen so many people actually take growth factor serums and microneedle at home and apply it over that, and that is a no-no. You really should not be doing that with anything that's over the counter. With microneedling, you're creating injuries in your skin, and you don't know if what you have is 100% sterile. So you do not want to apply anything non-sterile to essentially wounds in your skin, because you only want to follow a very clinical protocol if you're doing that. And if your dermatologist or your clinicians provided you serums that you can use after microneedling at home, sure. But nothing that is over the counter should be following that, including growth factors. Let's talk about storage and hygiene a little bit more. You do not ever want to decant your growth factors into open jars. Don't think, oh, I'm going to travel, let me take it out into this little thing. You're probably going to inactivate the growth factor. It's especially if it's in like an airless pump container. You want to use product that's coming straight out of that. It's going to mess with the stability of the serum if you decant it into something else. If you've got an airless pump, you definitely want to keep it closed. There are some products that are made with droppers. You 100% want to make sure that they're closed tight, they're capped between uses, and you absolutely want to avoid heat and direct sun on the bottle. So what are some red flags which if you see on a product, you should just skip it, you should not pick it up? Skip any products that only say protein complex with no named factors. We covered named factors EGF, FGF, TGF beta in part 1 of this series and how they show up on your label, like SH oligopeptide. SH stands for synthetic human derived. So you know that it's recombinant, it's something that's been created in the lab. If something does not disclose how it's been generated, if it's lab created, if it's sourced from something else, then you want to skip that product altogether. But there are some products that have great exposure that come in droppers, but personally I would be cautious of actually using them. I don't know how effective they would be. Also be skeptical if a label uses plant stem cells to claim human growth factor-like results without explaining exactly how. For human-derived blends, so quick summary, healthy skin only, patch test, separate from strong acids, keep it clean and capped. Save this if you plan to start growth factor soon. And the very next episode, we'll be talking about which growth factor products I would recommend at the budget, mid-range, and luxury categories.